Dear colleagues, today is our lecture devoted to the tertiary syphilis, congenital syphilis, laboratory diagnostics of syphilis, and syphilis treatment. Tertiary syphilis, it manifests itself in 50 to 73% of patients, promotes inadequate treatment or is absent in the previous stage of syphilis, severe concomitant disease, duration from 2 to 10 years or more. Patient in the tertiary period are slightly infectious. There are follow periods of tertiary syphilis, active tertiary syphilis, and latent tertiary syphilis. Tertiary syphilis includes the follow type of rashes, especially tubercles about 40%, gammas about 60%, and at last late roseola 1%. Tubercle syphilis. The tubercle is a dense, hemispherical, cavityless formation, the size of pear, color from purple red to honey red with a shade of cyanosis, clear borders with a shiny surface. Resorption. Resorption with the formation of cicatricial atrophy and pigmentation. Ulceration after rejection of virulent necrotic contents, the ulcer becomes more dense. The bottom of the ulcer becomes covered with granulation and forms a scar. Group tubercle syphilis. Compare with a shot at close range. Quantity vary from 30 to 40 tubercles. Form a mosaic scar. Creeping or setting tubercle syphilis. It is a frequent repeated rashes made to form a roller. Capture new areas of the scan. Plaque tubercle syphilis. It is a very rare form of syphilis, made to form a plaque, vary from 6 to 8 cm in size. At last, pigmentotubercle syphilis. Gamma syphilis. There are follow forms of gamma syphilis: solitary, multiple, subcutaneous, internal organs gamma, fibrotic gamma. Characteristics: development subcutaneous tissue, destruction of underlying tissue, contains gamma core. When resolving, stellate scar or cicatricial atrophy will appear. Complications: the fellow complication will appear, especially erysipelas, elephantiasis, bleeding, osteomyelitis. On this slide you can see different forms of gamma syphilis that localize on the face of the patient. You can see the destruction in violation of face of the patient. Below you can see the localization of gamma, especially on the front of the shins, and spreading ulcers will appear. Latent syphilis. Syphilis without active manifestation. Distinguished early, before 2 years, late, more 2 years, and at last unspecific. Forms of visceral syphilis. Early visceral syphilis in the primary and secondary syphilis. In the primary period of syphilis, clinical manifestation of damage to internal organs cannot be detected, often change in the hematopoietic system at 5 to 6 weeks after the appearance of a heart chancre, erythrocytopenia, thrombocytopenia, an increase in the number of leukocytes, erythrocyte sedimentation rate, monocytosis, violation of capillary permeability, and reduced resistance of the capillary walls. Late visceral syphilis in the tertiary period observed. Late visceral syphilis, characterized by appearance The affection of cardiovascular system, mesoaortitis, aortic aneurysm, aortic valve insufficiency, narrowing of the coronary arteries, liver damage, focal gamma, miliary gamma, spilled and infiltrative form of gamma, chronic epithelial gamma, kidney damage, amyloid nephrosis, nephrosclerosis, gamma lesion, pulmonary affection, appearance of gamma nodes, spilled gamma peribronchial infiltration with the formation of fibrous tissue, scatters gamma small foci will appear. Congenital syphilis. This infectious disease transmitted in utero from a sick mother to a fetus starting from the 5th month of pregnancy with damage to organs and systems with Treponema pallidum, associated with the onset of placental circulation in the fetus. Mode on transmission. Treponema pallidum enters the fetus through umbilical veins, lymph gaps of the umbilical vessels, damaged placenta with maternal blood flow. A woman with syphilis may end the pregnancy. Late miscarriage, premature birth, childbirth with early and late form of manifestation of congenital syphilis. Women who have been treated qualitatively for syphilis before or during pregnancy are born healthy children. Clinical classification. Early congenital syphilis, before 2 years, with a manifest cause. Latent, without clinical manifestation, with positive serological blood test. Late congenital syphilis, more 2 years, with a manifest cause. Latent, without clinical manifestation, with positive serological blood test. Early congenital syphilis. The following forms are distinguished: placental syphilis, syphilis of the fetus, syphilis of infancy from birth up to 1 year, syphilis of early childhood from 1 year to 4 years, late congenital syphilis from 4 years to 17 years. Placental syphilis. Placental change are follow swelling, 1/3 of the weight of the fetus instead of 1/6 in the norm, soft, fragile, variegated color. Diagnosis: findings of Treponema pallidum in the umbilical cord and fetal organs, inflammatory infiltrate, cells and tissue necrosis. On this slide you can see the follow morphological change in placental syphilis, especially the revealing cytoarchitectural change seen in congenital syphilis of the placenta. The chorionic villi are inlines and contain dense laminated connective tissue, and the capillaries distributed throughout the villi and compressed by this connective tissue proliferation. Fetus syphilis. Pregnancy can end. Miscarriage. Death of the fetus at 6 to 7 months of pregnancy. The birth of child with congenital syphilis. Stillbirth. Small size. Lightweight with cachexia phenomena. The skin is wrinkled, flabby, dirty yellow, the epidermis flakes off and wrecked. The fetus has unusual senile appearance, change in internal organs, liver, spleen are enlarged, dense hepatosplenomegaly. The lungs are enlarged, dense in the affected areas, the acquire a grayish white color, white pneumonia, change in the skeletal system, chondritis, osteoperiosteitis. Syphilis of infancy from birth up to 1 year. It appears most often in the first 2-3 months of life, damage visceral organs, central nervous system, bone and cartilage tissue. Syphilitic skin rashes, especially maculopapular, rash on the limbs, buttocks, face, weeping pupils around the mouth and anus. Syphilitic pemphigus with the localization of blisters on the skin of the palm, soles, and trunk. Diffuse papular infiltration around the mouth, on the palm, soles, and buttocks, especially appearance of Hochzinger sign. Deep cracks form around the mouth, leaving Robinson-Fournier radial scar. Syphilitic rhinitis, erythematous, slight swelling and induration of the nasal mucosa, secretory, pronounced edema and profuse purulent bloody discharge. Ulcerative, a deep defect is formed on the mucous membrane, the destruction of the cartilaginous and bone tissue of the nasal septum, which can lead to the formation of saddle nose. Damage to the skeletal system. Osteochondritis, the process is localized in the long tubular bones between the epiphysis and the diaphysis. It is recognized by radiographically. Osteoperiosteitis, there is a buttock skull, Olympic forehead, pseudo-paralysis, intrametaphyseal fractures, syphilitic phalanges, osteosclerosis in the phalanges of the finger, less often the feet. Eye lesions, chorioretinitis, damage to the retina and choroid on the periphery of the fundus, point pigmentation is formed, a symptom of salt and pepper. Polyscleroadenitis, lymph nodes increase, become dense. Damage to the nervous system. Children have unreasonable cry, anxiety, cysto symptoms, sometimes vomiting and convulsions. On this slide you can see the generalized erythematous, phagocytoid, scaly macula, papules, and pustules, and desquamation of the patient's hand. Early congenital syphilis. You can see on this slide the formation diffuse Hochzinger papular infiltrating, especially around the mouth. On this slide you can see early congenital syphilis, syphilitic pemphigus of the soles. On this slide you can see pathomorphologic change, especially in the early congenital syphilis, appearance of hepatosplenomegaly, fibrosis in the gate of the liver. On this slide you can see the portoportal liver fibrosis. On this slide you can see early congenital syphilis, specific osteochondritis of long tubular bones. Congenital syphilis of childhood. Characteristic signs: papular rash, condyloma lata on the skin and mucous membrane, Robinson-Fournier scar, gamut, damage of liver and spleen, damage of central nervous system, meningitis, epileptophonocytosis, hydrocephalus, mental retardation, periosteitis. On this slide you can see the baby that suffered from early congenital syphilis. On the body you can see papular distribution of rash. On this slide you can see the appearance of condyloma later. On this slide you can see the internal hydrocephalus of the brain of infancy. Late congenital syphilis. This period resembles tertiary syphilis. Characteristics: tubercle syphilis, gamut, damage of internal organs. Highlight signs: reliable, pathognomonic signs or unconditional signs. Possible dystrophy, significant signs of late congenital syphilis. Hutchinson triad, parenchymal keratitis, syphilitic labyrinthitis, Hutchinson cyst. On this slide you can see the clouding of the eyes. On this slide you can see the typical Hutchinson cyst. On this slide you can also the appearance of Hutchinson barrel cyst. Possible signs of late congenital syphilis: saber shins, buttock-shaped skull, Robinson-Fournier radial scar, syphilitic chorioretinitis, syphilitic gonitis, saddle nose, change in cyst, appearance of butt-shaped kiss of moon, Moser, Pfluger, Fournier-Pike tooth, change in the nerve system. Dystrophy. There are fellow forms of dystrophy that appear in the late congenital syphilis, especially with the high Gothic heart pelix, infantile little finger, a symptom of Dubois fissure, absence of the xiphoid process of the sternum, axiphoidism, Olympic forehead, an increase in the frontal and parietal cranial tubercles, hypertrichosis, widely spaced upper incisor, Gaucher diastema, Corabelli tubercle. The symptom of aphthysian is a thickening of the sternal end of the clavicle. In addition to congenital syphilis, dystrophy can occur in other diseases. Diagnosis of syphilis. It is a clinical data, laboratory, direct detection of Treponema pallidum in the detachable hard chancre, erosive papules, and primary and secondary syphilis. Second, indirect serological examination. Third, cerebrospinal fluid. Direct method of diagnosis allows detecting the pathogen directly in the biomaterial, especially chancre, papules, lymph nodes, amniotic fluid. Dark field microscopy infection with syphilis in rabbits. Cultural method, FTA, PCR diagnostic. Non-treponemal test, screening. Availability, mass character, Q criterion, non-specificity, false negative, primary syphilis, seronegative, tertiary latent syphilis, Wassermann reaction, micro-precipitation reaction, rapid plasma readings, and trust test, venereal disease research laboratory test. Wassermann reaction, recommended in 1906, is based on the ability of the blood serum of a patient with syphilis, in contrast to the serum of healthy individuals, to form a complement binding complex with specially prepared antigen, extract of Treponema pallidum, cardiolipin antigen, extract of bovine heart. It is assessed by the degree of delay in hemolysis. RPR, rapid plasma reagent, anti-cardiolipin test, a non-treponemal screening test that detects immunoglobulin G and M immunoglobulin antibodies to antigens with carbon particles released from damaged cells of patients with syphilis, flocculation, sedimentation, trust, colloidin red unheated serum test. Serology. Immunoglobulin M antibodies vary from 10 to 14 days to 6 months. G immunoglobulin from 4 weeks up to 2 years. Treponemal test confirmation, falsely negative test, sensitivity, but not for evaluation, 85%. FTA, fluorescent treponemal antibody, treponemal pallidum hemagglutination assay, enzyme link immunosorbent assay, TPI, treponemal pallidum immobilization test, TPI was recommended in 1949 year. Treponemal pallidum immobilization test is based on the phenomenon of immobilization of the culture of treponemal pallidum by antibodies, immobilizins, that appear after 3 to 2 weeks, available in the blood serum of patients with syphilis. Its main purpose is to recognize false positive results when performing a complex serologic reaction. Antigens are suspicion of treponemal pallidum obtained from the tissue of rabid syphilitic otitis. High specificity for late and latent and visceral forms of syphilis. FTA, fluorescent treponemal antibodies, positive already in the primary seronegative period of syphilis in the 80% of patients. With secondary syphilis, it is a positive in almost 100% of cases, always positive for latent syphilis. With tertiary forms and congenital syphilis, it is positive in 95 to 100%, unsuitable for evaluating treatment, recognition of false negative results. Enzyme link immunosorbent assay, high specificity and sensitivity. The principle of the reaction consists in fixing on the valve of the antigen with the interaction of treponemal antigens and antibodies of the serum of sick patient and special chromatogenic additives, colors. Treponemal pallidum hemagglutination assay. Treponemal pallidum hemagglutination assay based on determination of erythrocyte agglutination, but surface of which are fixed with the antigens of treponemal pallidum, which occur only in the presence of anti-treponemal antibodies. Treponemal pallidum hemagglutination test become positive 4 weeks after primary infection with primary syphilis. Low reaction titer are noted with secondary syphilis. The reaction titer increased more than 1 to 320 with latent syphilis. The reaction titer again decreased to low. Cerebrospinal fluid will appear in syphilitic eye damage, cardiovascular system, the presence of neurological symptoms, tertiary and congenital syphilis, lack of negativity in treated patients, indicators, cytosis, protein, sugar, serology, RPR, ELISA test, CPI, FTA analysis. vulnerable groups, commercial sex workers, injection drug users, homosexuals, mandatory, pregnant women, donors, in patients with neurological and mental disorders, children born to mother with syphilis. Treatment for syphilis. There are following forms of type of treatment for syphilis, especially specific treatment, preventive treatment, having contact with patients with syphilis for no more than 2 months, trial treatment, syndromic treatment, prophylactic treatment. Treatment of primary, secondary, and early latent syphilis according to protocol of Kyrgyz Republic. Benzatyl benzylpenicillin 2.4 million units intramuscularly once the drug is injected at 1.2 million units into each buttock, 2 stages, using 2 disposable needles. Or benzylpenicillin procaine 600,000 units intramuscularly 1 time per day for 10 days. Preventive treatment of syphilis according to clinical protocol of the Russian Federation. Bicillin 5 1.5 million units intramuscularly 2 times a week. Number 2. Benzylpenicillin novocaine salt 600,000 units intramuscularly 2 times a day daily for 7 days, or single injection of benzylpenicillin at dose of 2.4 million units. Treatment of patients with primary syphilis according to clinical protocols of the Russian Federation. Bicillin 1 2.4 million units intramuscularly 1 time in 5 days. Number 3. Bicillin 5 1.5 million units intramuscularly 2 times a week. Number 5. Benzylpenicillin novocaine salt 600,000 units 2 times a day intramuscularly daily for 20 days. Benzylpenicillin sodium salt 1 million units intramuscularly every 4 hours daily for 20 days. Treatment of patients with secondary and early latent syphilis according to clinical protocols of the Russian Federation. Benzylpenicillin novocaine salt 600,000 units twice a day, daily intramuscularly for 20 days. Benzylpenicillin sodium salt 1 million units every 4 hours intramuscularly, daily for 28 days. Bicillin 1 2.4 million units intramuscularly 1 time in 5 days. Number 6. Treatment of patients with tertiary, late latent, and latent unspecific syphilis according to clinical protocols of the Russian Federation. Benzylpenicillin sodium salt 1 million units every 4 hours intramuscularly daily for 28 days. 2 weeks later, the second course of therapy with the same drug for 14 days. Benzylpenicillin novocaine salt 600,000 units intramuscularly 2 times a day, daily for 28 days. After 2 weeks, a second course with the same drug for 14 days. Treatment of patients with early and late neurosyphilis according to clinical protocols of the Russian Federation. Benzylpenicillin sodium salt 12 million units intravenously drip in saline solution 2 times a day, daily for 20 days. With early neurosyphilis, at a later time, the same technique, but after 2 weeks, a second course with the same drug, 20 days. Benzylpenicillin sodium salt, 4 million units, 6 times a day, intravenously, per 10 milliliters of saline solution in a stream for 20 days during early neurosyphilis. With late, the same technique is repeated after 2 weeks for 20 days with late neurosyphilis. Alternative treatment regimen according to clinical protocols of Kyrgyz Republic. Doxycycline 100 mg orally 2 times a day for 14 days. Erythromycin 500 mg orally 4 times a day for 14 days. Azithromycin 500 mg orally once a day for 10 days. Ceftriaxone 500 mg intramuscularly 1 time per day for 10 days. Amoxicillin 500 mg once a day, plus probenecid 500 mg orally once a day for 14 days. Treatment of latent visceral gamma syphilis according to clinic protocol of Kyrgyz Republic. Benzylpenicillin 2.4 million units intramuscularly 1 time per week. The drug is injected at 1.2 million units intramuscularly into each buttock twice, using 2 disposable needles, 3 injections per course, or benzylpenicillin procaine 600,000 units intramuscularly 1 time per day during 17 days. Treatment of neurosyphilis according to clinical protocols of Kyrgyz Republic. Benzylpenicillin sodium salt, day doses of 24 million units. The drug is administered at 12 million units intravenously drip for 1.5 to 2 hours in 400 milliliters of isotonic solution twice, 2 times a day for 10 to 14 days, or benzylpenicillin procaine 1.8 to 2.4 million units intramuscularly 1 time per day, plus probenecid 500 mg orally 4 times a day for 10 to 14 days, or benzylpenicillin sodium salt, days dose from 18 to 24 million units. The drug is administered at 3 to 4 million units intramuscularly every 4 hours for 10 to 14 days. Thank you for attention.